All right, good morning, everyone. How are you all doing? Good Friday. I'm Charles Ellison, and welcome to another Council of State Governments Eastern Regional Conference Council on Communities of Color Micro Summit, what we call a micro summit. We coined this new term of these fantastic, dynamic, and very insightful conversations that we are having every bi-week. And this is being powered by the Council of State Governments Council on Communities of Color. Go to csg-erc.org for more information on the wonderful work that the Council of State Governments Eastern Regional Conference, more specifically the CCC, is doing. In fact, its director, Senior Policy Director, Debbie Ann Page, is joining us now. She will be also hosting and moderating and making sure that this conversation goes smoothly. Welcome everyone for being here. This conversation is recorded, by the way. It will be made available on a variety of platforms. I'm Charles Ellison, by the way, so I'm the moderator of these micro summit discussions. I'm also host, executive producer, and creator of a nifty little public affairs show called Reality Check on WURD. That's on a Philadelphia-based radio station, WURD. Go to wordradio.com for more information. I'm also at Ellison Report on twitter.com as well, hashtag reality check for that continued conversation there. So let's get started with this conversation. Very gloomy and somewhat sobering day. We've gotten more jobless unemployment numbers that have come out that have been released by the Bureau of Labor Statistics. So it just so happens the day that these numbers, that actually wasn't planned, but it just so happens the day that those new April jobless unemployment numbers come out, we're having a micro summit on working in pandemic, how communities are navigating this current labor crisis, because just as much as there is a public health crisis going on, and then obviously there's the ensuing economic crisis, we have a workers crisis that's happening either right before our eyes, or we're experiencing it, or our families are experiencing it ourselves. And so we want to unpack that and talk about that. We've pulled together a great panel of experts and analysts, also folks who are policymakers on the front line who are dealing with that as we speak. Real quick, just an administrative note. For those who are in the audience who are watching this conversation right now, you do have an opportunity to join in with questions and comments and feedback. Please leave that in the Zoom group chat to the lower right-hand corner of your screen. The Zoom group chat, we will be fielding questions via Zoom group chat. 30 minutes into the discussion, we'll start to ask, I'll start to identify some of those questions and comments and relay them as this discussion is going on to our panelists. Okay, so our panelists today are Connecticut State Representative Robin Porter. She's joining us here. She's at the top left-hand screen in your gallery here. She is also chair of the Connecticut State House's Labor and Public Employees Committee. She's the chair of that. She joins us here by Zoom today. Also joining us is State Representative Marcus Evans. And he is chair of the Illinois State House's Labor and Commerce Committee. He joins us. You see him in the middle of the screen as well. Also to my right is Dr. G.S. Potter. Dr. G.S. Potter is a political strategist, longtime political strategist, also contributing editor for the B-Note, the BENote.com, which is one of the primary vehicles and platforms that these discussions are also made available. She joins us. She's also a regular contributor, providing us with political and public policy insights on WURD as well. She's joining us here for this discussion. And then we have Dr. William Spriggs, who is, how are you doing, sir? He's at the bottom left-hand corner or to my left of the screen, chief economist for the AFL-CIO, also a professor of economics at Howard University as well. And then of course we have CSG CCC Senior Policy Director, Debbie Ann Page. She's also joined us in the discussion. She might be silent for most of the discussion, but she's just making sure all of this runs smoothly. And we do appreciate, all of this is possible because of Debbie, really. So we appreciate her every bi-week when we do these discussions. Thank you very much, Debbie. State Representative Porter, I want to start with you. Unemployment claims in Connecticut, I believe, have neared about, what, 300,000? If last check? It's even bigger than that?
We're over 400,000 now.
Over 400,000. And already, and that's happening as we have an unprecedented 20.5 million unemployment, unprecedented about 20.5 million jobs have been cut from the payrolls. We have about, 35 million nationwide who are unemployed. We have near 15% unemployment, at least officially. I'm sure you're aware of kind of what the latest report is saying. Is this capturing, especially for a state like yours, Connecticut, right next door to New York, which is the epicenter of this pandemic, is this capturing the full extent of this crisis? And what aspects of this worry you the most?
I do believe that it is. I mean, when we look at the number 400,000 plus, that is probably about 4 years of unemployment claims in 2 months. That is what this pandemic has done to the system of unemployment and people actually not having any kind of revenue sources coming in outside of what we've set up with the federal folks. What concerns me the most is that in Connecticut, we're dealing with an antiquated 40-plus year system. So we were already in transition of upgrading that COBOL system, and then this happened. So we have a system that was already struggling, that is being inundated, and also being pretty much burdened with federal programs that are coming down that are new, and there's systems that need to be set up, which is slowing the whole process down. And we have folks that have no income. So now we're dealing with people that are in need of resources and food and toiletries and just all kind of things. So I think the thing that distresses me the most is how people are in limbo right now, financially suffering, and what we're able and not able to do to the system in their time of need.
Representative Evans, I'll go to you next. Illinois had already been besieged by economic and state budget woes for quite a long time, and then this pandemic happens. Talk about who's getting hit the hardest in Illinois, and I hear that issue, that challenge in every state. Archaic unemployment benefits or unemployment claim systems that are just not prepared. In fact, some state unemployment offices receiving unemployment applications or claims, even just by fax still, right? So that's a problem. And so, I mean, is a state like Illinois, which is already, dealing with all sorts of fiscal and budgetary woes, is it prepared for something like this? How bad is it?
Yeah, I agree with you. And the flat out answer was no. And I think the governor's giving these daily speeches, and he's mentioned in his remarks, we're getting 12 times as many individuals filing for unemployment. So the system is overrun, even when it was running at its optimum state. It's the same thing. We were discussing combining some departments, so the governor has some great plans to make it better, and then all of a sudden here comes this COVID situation out of the blue. So it definitely was the worst possible time for COVID, but it is what it is. We got to figure out a way out of this.
Dr. Spriggs, so you look at the macroeconomic trends that are occurring, particularly as chief economist for AFL-CIO. You're looking at how those macroeconomic trends influence or shape the labor market. So you're looking at these unemployment numbers. First, what are you seeing there? What are some trends that are worrying you? And I wonder as well, does this pandemic moment give certain industries, certain employers an opportunity to do something that they wanted to do all along? Slim payrolls, also find creative ways to reduce overhead, roll back worker protections. Are you worried that this pandemic is being used as an excuse to do just that?
Well, we worry about rolling back worker protections, as you've seen in the meatpacking plants in Iowa and Nebraska. But more importantly, there are two things happening here at the same time. One is the absolute abject failure to plan. So we see that in the numbers. The numbers are overwhelmingly dominated by people who lost their jobs because of the need to implement a policy of social distancing. Now, back in January, you could foresee that was going to be needed. And so back in January, you needed to think, what's the plan? Knowing you're going to have to shut down huge industries. 12.6 million Americans work in restaurants. That's the size of our entire manufacturing workforce. So if I told you in January, at some point, we may have to close down that industry, don't you think you would say, oh, if we're going to have to close down an industry that employs 12.6 million people, our entire manufacturing workforce in equivalent size, we better have a plan. And as you've heard from the representatives, the unemployment insurance system, dumping the workers into the unemployment insurance system, that's the F plan. I give you an F minus if that was your answer. The A answer, the rest of the world realized, was you're going to have to pump money into those sectors, put the workers on a payroll subsidy so that you don't separate them from their employer. So just as if on State Street in Chicago, if I say I'm going to do a modernization and put in a tram, and to do it more efficiently, we're going to shut down the entirety of State Street, you'd have to compensate those business owners. They wouldn't let you just shut them down. You'd have to have a plan. How are we going to handle shutting down these businesses? And we have to have the same plan here. This is a failure to plan on that part. Then we have the greater danger, which is because of the fear and the anxiety around the disease. People aren't traveling, hotels aren't filling up. So there are two things going. One is a normal downturn, and this other, which is the bigger problem, is the failure to plan and the failure to come up with the effective systems in that plan. That's going to complicate everything going forward. The biggest crisis we face is those sectors, restaurants, amusements, they generate a disproportionate share of local revenue.
Yeah.
And so when they're shut down, state and local revenues drop, depending upon your state. New York counties rely heavily on sales tax, over 50% of their revenue. Same is true in many of the counties in Georgia. It just depends upon your state how much this is. We lost 800,000 local government jobs last month. 488,000 nationwide because we shut down schools. So of course, you don't need bus drivers, you don't need cafeteria workers, janitors, teachers' aides. So going forward, we already have the challenge that we've lost 800,000 local workers. Now comes the crunch because now state and local governments have to begin to pull their budgets in line with these declined revenues.
Okay. Yeah, that's
and so we are not going to have a recovery. We are not going to have a recovery until the federal government steps in to recognize this second part of the planning, which is you knew that state and local revenues would plummet because of these choices we have to make. And we're having the Senate saying we don't want to make up for that lost revenue. Right. That will guarantee that in the fall, these numbers are not going to be an aberration. These numbers are going to echo when we come to state and local government.
Yeah. Dr. Potter, what about those downstream impacts, right? Because a lot of what we're discussing here are top line numbers, whether it's in a specific state like Connecticut or Illinois, or we're talking about what's happening nationally. But then we think about those downstream impacts that aren't being highlighted as much. For example, what comes to mind for me is like childcare, right? Because there was already a childcare issue or crisis, lack of childcare, lack of accessibility to childcare crisis that was happening before pandemic. That's become even worse. So there's that downstream impact. And then thinking about kind of the political and community response solutions to all of what's happening now. I mean, is that it's a real dire situation out there, particularly when we're looking at this labor issue. But I'm real curious about the labor, about the downstream impacts. And then after you, Dr. Potter, I want to start going into what sort of the workplace right now, what the labor environment is looking like. and the erosion of protections for workers that we're seeing, all that's disintegrating right now as we speak.
Right. Well, one of the things I have to say is that I'm really cautious to use the word failure. I don't think it's necessarily a failure. As a political strategist, and I think looking back at our history, we have to really quickly start acknowledging that this is a success of the Republican parties, that the communities that this is affecting most are the people that they traditionally work against. They try to take our rights away. They try to stop us from having a place in the employment industry. They try and stop us from collecting services when we have them. So when we're seeing what communities are being hit the most, I think it's really predictable who it's being hit. So I'm a mixed race, single mother, low income. So we are definitely falling through the cracks. It's hard here. I recently moved to rural Pennsylvania, which I can tell you, like this red town, the disinformation that's flying around is incredible. And just going to the grocery store is horrifying. People are taking stances, like coming up to you with no masks on, because it's a patriotism for them to not wear a mask. So it's kind of scary up in here. And I don't have childcare, so you're going to see my kids running through. Hopefully they'll be too quiet. And I have not received unemployment. There was a new one I applied for, but because I cannot take a job because I do not have childcare, I'm not eligible for it. And women, especially women of color, we have been in the bottom of the basket for a long time. So I just want to rattle off a couple numbers real quick. When it comes to the wage gap, Native American women make 57 cents on the dollar. If it's a Native American mom, it's 48 cents on the dollar. For Hispanic women, Latinas like me, we're looking at 61 cents and 46 cents. Moms make 46 cents, Latina moms, to the dollar that a white man makes. And for Black women, it's 65 cents and 45 cents. So we're already starting with less income. We're not able to access unemployment in a lot of services because we don't have childcare. And it's really difficult to even work from home because you got babies asking for lollipops all day. But my rent is still due. My bills are still due. I've applied for every amount of assistance I can and nothing has come through. So we're definitely falling through the cracks. And when it comes to looking for solutions, again, I think I gotta say, it's really scary to me to approach it as a failure because I come from homeless communities of color. We've been experiencing this our whole lives. This is just what's exacerbating it. So I think we need to be a little more aggressive and start saying, you know what, this isn't a failure. This is the GOP succeeding and we need to counter hard.
Once again, if you're just now tuning in, or if you just are coming, I saw a few people join into our Working in Pandemic Micro Summit being made possible, powered by the Council of State Governments, Council on Communities of Color, the Council of State Governments, a long name, Council of State Governments, Eastern Regional Conference, Council on Communities of Color. I'm Charles Ellis and I'm moderating this discussion. You can leave questions and feedback and comments in our Zoom group chat. You can start doing that now. In about 5 or 10 minutes, I'll begin relaying those or asking those to our panelists very shortly, in about 5 or 10 minutes. So you can start doing that now in our Zoom group chat. We're talking with, you just heard Dr. G.S. Potter, also State Representative Robin Porter, State Representative Marcus Evans, also Dr. William Spriggs as well, joining us here. Representative Porter, you know, I am worried about that worker protection piece. And you and I talked about this recently on WURD, on my show, Reality Check, on WURD. And I mean, you're seeing some very disturbing patterns in terms of, you know, workers being forced to go out into the field. First of all, we've completely redefined what frontline means because people were under the assumption, oh, frontline is just first responders, nurses and doctors. No, it's the fast food workers, grocery store workers, people being forced to work with, even as they're sick. Talk about that. About your worry over those erosion of worker rights, worker protections.
I mean, it's gut-wrenching for me. It's a belly ache and a heartache to watch what is happening with what we're calling essential workers who are basically being treated like sacrificial workers. Here in Connecticut, we have huge issues around workers not having enough PPE. I mean, today we're actually doing a caravan to Hartford, you know, legislators to stand in support with these workers because they're reporting to work and instead of wearing gowns, they're wearing trash bags. I said trash bags. They're being told to use their PPE, their masks, for a month. It was a week. Now it's been stretched to a month. That's cross-contamination. And then we found out in a conversation a few days ago that some of these workers are actually being instructed to share PPE. How do you share a mask? How do you share a gown? We have our COVID units within our nursing homes now. Nursing home I was at yesterday, the 3rd floor is a COVID unit. And one of the workers actually said to me, she said, you know, they're treating us on the 3rd floor like we're rabid dogs. And I said, what do you mean by that? She said, no bathroom breaks, no break room. We are not allowed to get on the elevator when we come in and out of the building. We have to use the stairs. The things that they're being subjected to me, are not only inhumane, they are criminal. We have workers that should be getting sick pay, that work our rest stops up and down the highways. They're not getting sick pay, so guess what they're doing? They're coming to work sick. So, I mean, those are the kind of things that we're seeing here as far as workers' rights and people just being forced to do things, incentives, and they're calling them bonuses. That's the other thing that was reported to me. They'll give you the bonus if you have perfect attendance and if you're not late. But if you are late or you don't have perfect attendance, you don't get the bonus. The other issue I see with workers' rights is how do you tell people they have to go into a hazardous work area without paying them hazard pay? So there's many issues that are really not new to COVID, but just being really highlighted because of COVID, and the disproportionate impact on Black and brown workers is just astronomical. And for me, it makes them, it's reminiscent of slavery and the plantation, because they are not taking care of their workers. These workers are dying, their family members are dying, and there are things that these employers, and I feel that we as a state and local government could be doing to ensure protections and supports for them, to ensure that they're safe when they go to work.
In your state, Illinois, Representative Evans, what's that conversation like about employers doing what they need to do or equitably preparing for their employees, right? What's that conversation like? What's that conversation like to directly with those industries? Are they not only aware of these concerns, are they also aware that people are seeing how they're conducting themselves, how they're behaving and managing this crisis, how, because word's getting out. And so it may not be a mainstream national discussion, but people are aware of some really severe deficiencies that are showing up in workplaces. And we haven't even, normally when we've been talking about working, we've been talking a lot about telecommuting and how people have had the ability to stay at home and work. But there's a vast section of the workforce that doesn't have that luxury, like us, like how we have right now here in this discussion. So talk a little bit about that.
Yeah, again, focusing on people of color, which is what we're doing. People of color, we have issues. We're on those frontline jobs. You look at all of the data disproportionately. When you're going into restaurants, when you're going into the grocery store, downtown Chicago, who are your servers? Who are your busboys? Who's working at Whole Foods? Stocking the shelves. It's a person of color. It's a woman. I mean, these are the people who are on the front lines. Our relatives work in hospitals as transporters, janitors. I mean, all these people are being subjected to potentially 4 or 5 individuals who have COVID per day. Are the hospitals doing a good enough job? I think initially they were, but in my view, we're getting this lax behavior now, because people are ready to go back and enjoy life. But we still got to see that it's still an issue. I don't see the hospitals. I don't see the facilities, nursing home facilities. We have an issue now with our nursing homes. A lot of the support staff aren't getting the proper masks. They may give the doctor N95 mask, but tell the nurse, you just work with whatever you got, or tell support staff to work with whatever you got. Well, who are these people that support staff? Who are the $10 an hour person? We're telling people to risk their lives for $10 and $15. But we're protecting the people that's making $200,000. I mean, these are the issues that's going on in facilities. We are sending a message to the governor, and he's sending a message that workers should still be protected, but we're not taking any chances. We filed the bill, House Bill 57, 69. My colleague Andre Tapetti filed it, and I'll be added as a co-sponsor. Just send a message that, you know, we want these facilities to protect the workers. And it's usually the workers that look like us, and that's what I'm most concerned about.
Yeah, Doctor, go ahead, Representative. I'm sorry.
You know, it's not, we haven't fully opened up. You know, our governor laid out this 4-part plan to open up, and we're sending him the message constantly that Corona's not going to leave even when we open up. It's still a recovery process to protect the workers during this process. It could be months. They got to provide. You know, if I'm making $10 an hour, I can't afford a mask. You know, we do mask pass outs, and we're passing out thousands. People still need more, and it's responsibility of employers. We don't want our employers to rely on desperation, because when they're desperate, the worker will be the person that bears the brunt of it. And Dr. Spriggs, I know he's going to touch on this. I really love what you say. You know, that's what I'm concerned about, that, you know, they're desperate and they're worried about their bottom line, so they don't care about risking the lives of people that look like me.
Mm-hmm. Yeah, Dr. Spriggs, and we didn't even get into, because I know that speaking of employers and like small businesses, that really are the engine of not just economic growth, but the labor marketplace, right? And then the Small Business Administration there was reports yesterday about how they've been quietly, they've dramatically lowered the cap for business loans from, I think it was like $2 million now down to $150,000. The Paycheck Protection Program obviously is an epic failure. That's not working. So you're not getting a whole lot of federal support there. There's a number of other things that aren't happening. Some of it just due to just this unprecedented volume of crisis management going on. And a lot of it, as Dr. Potter was saying earlier on, a lot of it deliberate. But Dr. Spriggs, real quick, I want to ask you, what is the ideal labor workers' rights framework, or what's sort of the ideal infrastructure to, in your mind, as you're seeing this unfold? You kind of hinted at it earlier when you were speaking about like what other countries are doing, but what's kind of that ideal framework right now? Are there elements of that ideal kind of, as you envision it, framework that could be applied now? And I guess we can't rely too much on the federal government for that, but maybe there's some things that cities and states individually can do on their own.
Well, worker safety has to be at the forefront of it, because we still need the economy to function, but that means people have to be safe at work. We need better information. So we have to have states force the collection of data. We have to know where is the virus. So a lot of people want to know about race, but we don't just have the disease. We get it at work. So we got to know which workplaces are infected. So we must mandate the reporting of the infection so we know where it's located. That's one. That then lets us plan. Second thing, for worker protection, we're going to need states to change their worker comp laws to give a presumption that someone got it at work. So if I'm a frontline worker, I don't have to fight with, did I get this at the grocery store as a clerk in order to get workers' comp? That has to be a presumption for frontline workers that I got it at work. We do need the federal government to get on a war footing. We've lost 72,000 Americans. That's more than we lost in Vietnam. We're well on the way to losing 80,000, which would be the total combat deaths in Vietnam plus Korea. So we are in a war, but we have not taken a war footing. So the federal government needs to step in, because the state budgets are already overspent. We need the federal government to step in so we can have tracking. Once we understand where the disease is, then we need trackers. We need to be able to track people's movements, and I deal with the big data on tracking people's movements. This is frightening to me. There are all sorts of security issues for individuals. We need trackers to be hired in order for us to track the disease. So these are some of the sort of low-hanging fruit, but at the state level and the state legislative level, enforcing the reporting of the disease And as we heard from Representative Porter in Connecticut, and you asked the question, we have to hear from hospitals. If somebody comes in, we need to know who you sent back home. This is part of the tracking. So you can't just send people home and then we don't know any numbers. Hospitals have to report that to us. In any combat situation, the number one thing you want to know is, where is my enemy? Mm-hmm. That's number one. That's number one. Remember, we were willing as a nation to ditch our values, waterboard people, and torture prisoners, humans. This is a virus. It's a virus. But we don't want to go after the information about the virus with that same veracity. That's sad. That's sad.
Dr. Potter, talk about that ideal response framework in your mind, like with that protection infrastructure could look like. One other thing that comes to mind too, particularly as we were hearing that the Trump administration is going to move forward with plans to completely eliminate the Affordable Care Act. So that's another layer of crisis that folks have to deal with. So there's a lot of, people already were dealing with non-insurance or underinsurance issues. Now they're talking about taking away that public health prophylaxis, the Affordable Care Act. Just a whole lot that's going on there, and we can barely wrap our heads around it in just this 1 hour session. But I'm real curious as to your thoughts on what that response framework, ideal response framework looks like for you.
I think the ideal response for me, I think we have to decentralize labor right now. I think we have to give people like me in the positions where we might have to go out on the front lines if we want to feed our families. I think we need to take that off the table. I think we need to look at cities and states that are doing rent freezes and rent forgiveness and mortgage freezes and mortgage forgiveness and utility freezes and utility forgiveness. So people that are in the positions to be targeted by the Republicans are no longer in those positions. Let the landlords and let the politicians and the banks fight it out, and then let the people have some safety and shelter and gas and heat and electricity, so we can survive and then figure out how we want to proceed moving forward. And I think we also have to look at, in terms of like frontline workers, there's also folks like caregivers and housekeepers and immigrant communities that aren't even on the radar right now, that have limited, if no protections, that still need to be protected. So I think it really needs to be more of a bottom-up infrastructure where labor plays a key organizing and vocal role, but we have to also pick up the families that they're supporting that aren't able to enter the labor force. And we have to do it by also targeting banks instead of always working on how much more can we put into the labor, how much labor can we get out of people, and start saying, okay, maybe banks don't need to be collecting those rent and mortgages, and we can take that off the heads of the laborers.
All right. No, thanks, Dr. Pot. Representative Porter, and actually, I want to get to this question real quick because Debbie raises a good point. Dr. Spriggs, how do you explain to communities of color about tracking? What do we mean by tracking?
So we need to know who has the disease and then who did they encounter.
Right.
So currently, there are people doing research because you got your cell phone, and that data is out there. People are tracking you. They know whether you are staying in place or not staying in place. They know whether you went to a Chinese restaurant versus an Italian restaurant. That data is out there. This is rather frightening. Instead of who knows what is controlling it, we need people hired so that when you reopen, we can follow the disease and we can detect the hot spots. So we know which employers are the cause of the problem. So we have a better chance to intervene properly. But, Representative Porter and had mentioned about people coming back home and then their family members get the disease. So this method of transmission within our families starts from our encounters, whether we're a bus driver or a train driver, or whether we're a frontline clerk. And so that's what the tracking is about.
We also have Anastasia Williams in the audience who's asking, and I'll throw this out to the state reps here, is your current workers' comp insurance for the entire state, or are there private insurers playing a role now as well? That's an interesting question. Thank you for that question, Anastasia. Representative Porter, you want to jump in on that? And then Representative Evans, you can follow up.
It's a mix. It's a mix. And I think when you talk about the element of private insurance, we know what happens with that. Here in Connecticut, we actually are having huge issues. And I'm working really closely with Jennifer Berrigan and Sal Luciano, AFL-CIO, Mr. Spriggs, on the workers' comp presumption because of the fact that we have workers that are contracting COVID that are essential frontline workers, many of them bus drivers that we were talking about the other day, and their workers' comp claims are being denied. And the thing that's most frustrating to me is that we talk about, because we are definitely pushing, we've been in conversations with the governor, we've had the House Dems and Senate Dems sign on to letters to the governor requesting that his executive order address the need for the workman's comp presumption. But for me, this is it. I'm like, if they weren't mandated to go to work, and if they had the luxury and the privilege of sitting at home like we are, working for our homes, and they contracted COVID, then they could self-isolate. Self-isolation is not an option for them. They have to go to work. And many of them are choosing to go to work sick because they're not getting any sick days so that they can stay home and be well and not infect people. So to me, it's a no-brainer. I mean, that is definitely one of the legislative policies that need to be in place and permanently in place.
Yeah, Representative Evans. And by the way, that's State Representative Anastasia Williams out of Rhode Island is asking that question. So thank you, State Representative, for joining in on that. But Representative Evans?
Yeah, we would just focus on the workers' comp. Our governor is indicated that he's open to COVID being a presumption for receiving benefits under our workers' comp. So it's a little different, and we have a strong union influence here. The head of our Illinois AFL-CIO was a UFCW worker going way back, so he understands those true frontline workers in the grocery store, so, for us, it's a little different now. As far as the private insurers, there's always been issues, and some of the same issues, not having to repeat everything the Representative Porter said, but it's some of the same issues with our private employers. And I think it's going to require advocacy and legislation and really pushing them to do the right thing, because, what I'm seeing now, again, is a lot of desperation among business folks. And that's why the feds definitely need to come in, because that desperation won't be good for the frontline workers.
I'm real curious too. I'd like to get folks' thoughts on, and once again, real quick before I go into that next question, audience members are encouraged to submit questions and comments as well. You can do comments as well in the Zoom group chat. The Zoom group chat to the lower right-hand corner of the screen. Go ahead and do that, and I'll, as I said I would do, I'll relay those to the panelists, and the rest of the audience can hear that as well, and you can get real-time responses to those questions, comments, and any feedback that you'd like to leave too for this micro summit on working in pandemic. I'm real curious, just throwing this out here to everyone. Feel free to, whomever wants to jump in can jump in. What does the future of work look like right now? And that's not just in terms of how organizations are handling this moment. That's not just in terms of, we now realize that through teleworking, through being, working out of home or being forced to stay at home, we now have discovered new efficiencies that also entails worker rights and labor rights, worker protections. But what does the future of work look like right now for you all as you're thinking about that?
Yeah, that's if I just jump in quickly, that's a very interesting question, because see, when someone's at work, they get an hour break, but there's a lot of potential regulations around working from home, because you don't want a person to become a slave to the computer at home. If I'm working at home, can I step away from the computer? Could I go outside how's the bathroom break calculated? So I don't want to just push into everybody can work at home, because it's going to take a lot of regulation around it, because I can see employers, potentially taking advantage of folks who are working at home. But I do see it as it used to be where we can't do that. Of course, now we can, but it's going to have to be some protections for sure. I'll just hit on that point.
Mm-hmm. Yeah, go ahead, Dr. Potter. And I know you're there, Dr. Potter. So feel free to talk. But Dr. Potter, Dr. Spriggs, and also Representative Porter, what's that future of work look like? Because I hear there's a lot of conversation around that. But when we have that conversation, we think about, oh, wow, this new fascinating frontier, this post-pandemic frontier of a new redesigned workplace or workspace. But there's some other things that we need to consider there. There are those equity gaps. There's a systemic racism. There's a systemic harassment and abuse of workers that we have to consider when we're looking at that future workspace. So go ahead, anyone jump in on that.
Right.
Well, I want to just real quick point up what the state rep just said. He's talking about shaping the future of work. And that's what the discussion has to be. Coming out of this, we've learned some lessons. We can't take this as tech talk and people in Silicon Valley are going to tell us what the future of work is. Coming out of this, we have to absorb the lessons and shape the future of work. We're in the situation we're in because we let other people dominate and tell us what work would be like. Now we're understanding all of the fault lines that were created by that. The workers we consider essential right now are the lowest paid workers in the United States. They have no sick pay. This is a problem. Immediately we understand that. Most of them don't have health insurance. If they lose their jobs, as you mentioned, Charles, they lose their health insurance. That's a problem. So we're seeing all the fault lines. It's coming apart. And what we need to do is to talk about going forward, knowing that that model does not work. The number one thing we need to absorb from this is that did not work.
Yep.
It is not serving us well now. So we can't have people tell us. We have to take the initiative on analyzing what are the obvious fault lines and start fixing them. You can't pay people below $15 an hour because if something happens, they have no savings. They have no way to cushion themselves. So there are all sorts of lessons coming out. Workers have to have voice at the workplace.
Well,
This is the problem we're having.
Let me go ahead.
Power workers.
Hold on, Dr. Potter, go ahead.
Yeah, with all due respect, I think these are things that we've known for decades, for generations. These are things my grandparents and great-grandparents have fought against. And I think that, yes, we need to expand that message and find new creative ways to get that message to different communities, but labor needs to organize. I think right now, with the administration we have in place especially, we're rolling back the rights far past what we achieved in the civil rights era. We're going back into the 1800s with some of this stuff. And we're putting Black people and brown people, their bodies, our bodies, on the front lines. And that we're working against white nationalists. And white nationalists are very comfortable driving us 6 feet under to line their pockets. So right now, I think what communities of color need to do is stop talking, and we need a full-on, across-the-board, well-organized, well-centralized labor movement saying we will not go to the front lines until you give us testing, until you give us PPE, until we have our rights and protections, and then we move from there. I think the idea that talking and debating is going to fix this, we have not seen that played out, and over history that has never played out. And we're up against the biggest crisis, I think, as a community of living people we have faced today, and we need to come together and put a stop to it and say, we will not go to your front lines. These are our families until we get what we need. And that's going to take a lot of effort, a lot of organizing, and a lot of planning. But what it's not going to take is more debating. We know these facts. We know who's going to get hit. We know who's going to die. We are all right here pretty good predictors of how many people from our communities we're going to lose. So I think now's the time to put boots on the ground and start taking some actual action.
Representative Porter.
Wholeheartedly agree. I wholeheartedly agree. You are singing to the choir. I mean, my thing is, we've been dependent on a system that was designed to devour us, to deliver us. I think that is just, not a good way to be looking at things. This is not our first rodeo with pandemic or any kind of crisis. We have always been disproportionately impacted. And I don't see that changing on the other side of COVID. It is going to have to be a grassroots movement. It is going to have to be boots on the ground. And we're going to have to get back to the basics, and we're going to have to get back to being a village and taking care of one another, and stop looking for the folks that don't care about us to take care of us. It's just not going to happen. So we need to reframe on a local, very grassroots level what it looks like as we transition through COVID, as communities, villages, and how it looks when we come out on the other side of COVID. The one thing that I'll add to that is that legislatively, myself and State Representative Evans, we should be talking about a more robust safety net. You know, when I think about the fact that people don't have the resources they need right now because they're out of work. This is nothing new in Black communities. We've always had a high unemployment rate. So this just exacerbates what we're going through. So I think that we have to really change our strategies, change our mindset, and it's going to be hard because as a people, we have always been divided, and that's how they've been able to continuously win, right? Divided, we're conquered.
You know, is that, Dr. Spriggs, is that realistic too, or is that something that's been talked about? I'm just curious now, something Dr. Potter was saying that triggered this. Has that been talked about? Like, you know, some sort of big national or nationwide, like, work stoppage movement. Hey, you know what? We're just going to stop working for the moment until you all, especially you folks on Capitol Hill, get your act together. And make sure that that the response to this on a labor level is being done not just adequately or responsibly, but it's also being done effectively as well.
Well, we need to change our labor law so we can do what you're talking about in a different way. But currently, the UAW is returning to work. The plants are going to reopen, but that's because the UAW negotiated what would be the safety terms. The machinists returned to work with the same conditions, and we can look to that as a model. But the labor movement has been very supportive and helpful to workers at Amazon who have reached out to the UFCW to organize because they're frontline workers who are being mistreated and being exposed. We see the voices of workers popping up, and it is coming from the ground, but we have to empower them. We know you have to have laws to make that happen. It doesn't just happen in a vacuum. The success of movements has to have things happening at the top and at the bottom. And so we had the House of Representatives totally revamp our labor laws so that we could respond as a movement. Currently, it's against the law, for instance, for us to have a secondary boycott. So it's not possible for the labor movement to say, we're going to shut down the country. We can't do like that.
Isn't the purpose of mass movements, though, to change those laws? I think when we get into
we got the House to pass the change. We got the House to get us back to. We got the House to get us back to before the Taft-Hartley restraints were put in place. We need the Senate to do the same thing.
And we know
we have to re-empower the American worker so that the American worker can move forward.
Go real quick, Dr. Potter. What was that last thought?
Well, I think if we're just being honest strategically, we know where House resolutions, especially those that benefit the people, go when they hit the Senate graveyard. And I think historically, we also know that mass movements happen because legislation won't be moved. So I think instead of kind of switching the direction of the cart and the horse, that maybe you people at the AFL-CIO and other labor directors can help us figure out ways and stand up for us and say, you know what, I don't want to kill my family. I don't want to die. Like, this is something I'm actually really struggling with right now. And you can help us and say, yep, you know what, this law is in place, but we're going to move forward anyway. We're going to creatively think of strategies and go back to our past and use strategies and come up with ideas to make sure that lives are saved and not use policy as an excuse to not do civil disobedience. The heart of civil disobedience is that the policies aren't there for us.
Yeah, so I think one of the things I want to say is the history of civil disobedience is needed help. And so even when you look at the history of the civil rights movement, you had to get people out of jail when they protested. We didn't just let them rot. We raised money. We had a source of support for that. In fact, Dr. King got out of the Birmingham jail because the United Auto Workers paid to get him out of jail and sent one of their organizers down to Birmingham to get him out. So it takes a lot to make a movement work. And sometimes people see the top line and they don't see the underworkings.
So what I'm saying is, instead of telling you,
hold on a second,
underworkings have a lot of support that's necessary. So the workers in Amazon who have stepped forward, they have had the support of the AFL-CIO, and the UFCW has been in there to help them figure out how they can organize. And they have helped other people in their organization on the front lines right now who are dealing with safety. But we also have to change the policies so that it affects all workers, even those who are afraid to raise their voice.
Dr. Spriggs, Dr. Potter, go ahead. Real quick,
well, I think right now,
seconds.
You're looking at an unprecedented time where you're going to have millions of more workers than you've ever had that will need your support, that are willing to say, no, we're going to stay home if you give us the tools to do that. And what I'd like to hear from people like you, because I talk to folks like you all the time, and what they do is they tell me the policy in place that says to them, we can't organize you, or we're going to organize by company instead of by racial communities or by large communities. And what I would like to hear more of is, you know what, you're right, we need to do that. So what I need to do is organize a system of finances so we can help you. And I want to hear, what are you going to do? Who are you going to call to set that up? What kind of infrastructure are you and the, Black businesses, Black banks, Black entertainers, Black whoever you can get money from, what are you going to do to put that infrastructure in place? Don't tell me that we can't do it because it's not in place. Tell me how you're going to do it. And I think the workers will definitely support that, because we don't want to die for $7 an hour.
Dr. Potter, thanks for that. Hold on one second, Dr. Spriggs, because I know that Representative Porter is going to have to go in about a couple of minutes. So Representative Porter, I want to get some parting thoughts from you. I may go on for another 5 minutes. This is a really good exchange, though, however. I do appreciate Dr. Potter and Dr. Spriggs in that exchange right there. Representative Porter, and also Sonia Jelks is asking, are there any national or local organizations looking to address these COVID-19 labor issues outside of state legislators like yourself?
Well,
Representative Porter?
I just want to go back for a minute because, I'm listening to the conversation that was just being had between Mr. Spriggs and Dr. Potter. And the thing that's frustrating here is that, we have written the letters, we have done all that we can do. I mean, and I'm talking labor movement, strong labor movement. And right now we have 32 BJ who has the rest stop workers, right? They are lawfully entitled to sick days. They're not getting them. In Connecticut, if you work on state property, there's a standard wage law, that says you have to give these workers health care. And if you don't, 30% of that needs to be added into their paycheck. That's not being done. We're debating that right now with the Attorney General's office and the Department of Labor. So we put policies in place and then they're not enacted. They're not enforced. So I think that's a big problem. So I hear what Dr. Potter's frustration is, but I also hear what Mr. Spriggs is saying as far as the labor movement. We need to be able to coalesce and come together and figure out how we work together with both of these ideologies to move us forward. Now, ask the question because I didn't forget, and I actually do have.
Just other organizations. Maybe it's like local, state, national organizations outside of state legislators that are that you're aware of or that you feel we need working through this COVID-19 labor crisis.
Well, yeah, I mean, there's a lot of local grassroots organizations that are doing the work and mobilizing people and organizing people. It's hard because of COVID, because we have to social distance. We can't get out there and do the things that we usually do along the lines of protests. So what we're doing in the meantime is we wait on government to do right and employers to do right, is that we're coming in as just, community folks, right? We're feeding people. We're making sure that kids are taken care of, that old people and our elders in the communities are able to, get their prescriptions. We're addressing filling and bridging gaps financially for people. We're raising funds. We're asking for donations. We're helping people pay bills. And this is what I'm talking about, just getting back to being a village, because, you know, the city is waiting on the state for funding. The state is waiting on the feds for funding. And in the meantime, in between time, our people are dying. So what are we going to do? We can't sit around and wait anymore. There has to be some action taken.
Yeah, Representative Evans?
Yeah, it's the same. I think it's really about, we know we want to fight. And I love what Dr. Spriggs is saying, and I think we should really take it in. You know, we got to fight on multiple fronts. We already had to fight, but now we got to fight harder on multiple fronts, because everybody doesn't want to fight the same way. So whenever we can get a person fighting, that's what we need to do. We need, you know, again, I'm fighting on various fronts. I'm helping the lady next door to me just get a mask. She don't care about policy and all other things. Some people just want a mask. And some people are trying to figure out how to clean public transportation. Some people, so there's so many different fronts. I think we got to, you know, hit it on all those fronts. And the conversation like this have to fire folks up, the people that's listening, so that everybody can have their hand in. Nobody should be doing nothing. And I think that's what's really needed now.
You know, I'm actually going to wrap this conversation, because I know, once again, I know State Representative Porter has to go. Everyone else also has busy schedules as well. This was great. We went a little bit over our hour mark. It was very, okay, so I'm promising not just a part 2 to this discussion, but I'm feeling like we need a whole, I was just texting Debbie saying, you know what, we might need a whole sort of like future of work series, like just a series of conversations specifically honing in or focused in on this topic alone, because there's a lot of anxiety out there and people are wondering, okay, well, what's happening to me, my community around me, what can I do? So I do promise we're going to be doing some follow-up on this labor issue, this work issue by itself. I mean, we'll be bringing all of, and some other folks, all of our panelists here now and some other folks to participate in those future discussions. State Representative Robin Porter is a state representative out of Connecticut, also chair of the Labor and Public Employees Committee there in the Connecticut State House. State Representative Marcus Evans is a Illinois state representative and chair of the Labor and Commerce Committee in the Illinois House. Also, we've had Professor Dr. William Spriggs. He's chief economist at the AFL-CIO and also a economics professor at Howard University, and Dr. G.S. Potter, political strategist from West Coast, now out here on the East Coast, and also contributing editor for the bnote.com, regular contributor on WURD's Reality Check. I want to, Debbie Ann Page doing a wonderful job co-hosting and also making this. Always want to thank Debbie for making this whole Micro Summit series, which is going to be ongoing in perpetuity. She's been doing a wonderful job. And I just, I just always want to thank her for making this possible, these discussions possible. And these discussions, the great thing about this, was the differentiator with these discussions, we're moving them into the next phase, which is, okay, well, how do we craft some policy out of this? What are some actionable items from these micro summits? So that's always the next stage. I promise you that. And those who are also tuning in, I want to thank our audience members and folks who've submitted questions and comments. I see some of those comments. We didn't get a chance to get to those, but we will provide those at some later point. This conversation will be made available at the bnote.com and also on social media, primarily Twitter. You can go to twitter.com and tag me at Ellison Report, also at CSG_ERC on Twitter as well, CSG-ERC.org, and then click on communities, Council on Communities of Color, because you can see the whole COVID-19 resource page, and all these conversations have been curated right there. Listen, everyone, I want you to have a great weekend. Happy Mother's Day to everyone. Happy Mother's Day to everyone on this panel. And please be safe out there. Stay healthy and well. We will talk to you during the next Micro Summit, or just go ahead and call into Reality Check on Mondays through Thursdays, 10 a.m. There's my shameless plug on WURD. Go to wordradio.com. But I'm Charles Ellison. Thanks again for joining us for this Micro Summit. We'll see you again.
Thank you.
Thank you.
Thanks, guys.
Thank
Thank
you.
you all.